Hi, so in this video, I'd like to discuss a little bit about HPV infection and how it can potentially lead to cervical cancer and what type of treatments that we can offer. So HPV stands for human papillomavirus, and it is very commonly sexually transmitted infection that is the highest risk group. It belongs to women who have multiple sex partners and do not practice safe sex. So these women are most prone to this type of infection, but in most cases, 80 to 90% of HPV infections, women, when they develop this type of infection, they do not actually exhibit any types of symptoms or complications, because most cases these HPV infections are actually harmless, and over time your own immune system will actually flush it out from your system, so your own body can fight it off actually. And also nowadays there are several vaccinations available for this type of infection, but there are specific strains or species of HPV that can develop into cervical cancer, specifically HPV 14 or HPV 16. So these types can develop into cervical cancer, but before they become cervical cancer, there is an intermediate stage which we call as Cervical Intraepithelial Neoplasia, CIN. So when you're during this stage, there are several forms of treatment that we can offer to patients. So standard protocol, standard treatment that a lot of hospitals provide is firstly cryosurgery, which is using liquid nitrogen to freeze this abnormal tissue and then removing them. Secondly is a cervical colonization. This basically means we are using surgery to remove the cervix so that it doesn't spread anymore. But we believe that these types of treatment actually will cause some long-term complications and also some unnecessary damage to the reproductive system. So here at Antai Hospital, we have a specific liquid medication that we call Antai liquid medication, or Antai, and it consists mostly of acetic acid or ethanoic acid mixed with other compounds, and it is a very corrosive medication that is very effective in removing these abnormal cells. So after a pap smear and after colposcopy, if you are positive of the CIN, we will administer this treatment by applying it on the surface of this cervix where there is abnormal tissue growth found. And then after 2 to 3 days of close monitoring, these tissues will actually shed off, revealing healthy tissues beneath, and then it prevents it from developing into cervical cancer. So I hope this video can give you an awareness about HPV infection, how it may lead to CIN, and CIN may potentially lead to cervical cancer. Now we say potentially because there are several factors that are in play, and we are also unaware what exactly triggers it to go from one stage to another. Factors such as environmental factors, patient's health condition, her immune system, and her lifestyle habits, all of these play an important role in helping us predict whether it goes into a cervical cancer.